Hello again, I'm Dr. Nunez with Living Health. This is a series of videos on how lifestyle can impact your health and your well-being. These are tips on what you can do, the choices you can make to take control of your lifestyle, which will impact your health and your sense of well-being or wellness. Today I wanted to talk to you about the subject of low T. Gets a lot of press and gets advertised, and a lot of men worry about low testosterone. Well, what are the issues? Why is it that men are worrying about this? Testosterone tends to drop naturally after age 30 by almost about a point per year. So some people think, well, what can we do about that? Do we need to do anything about that? Is there something we can do in lifestyle that can improve that or can mitigate some of that loss of testosterone? And the answer is, in general, yes, there are some things you can do. What is it that's causing you problems with low testosterone? If it's things like mood, that you're more depressed, that you have lack of energy, that you feel more fatigued, tired, those kinds of things, there are things that can impact that through your lifestyle. If there's also sexual functioning that's diminished, or desire that's diminished, there are lifestyle things that can be done to improve that as well. Yes, it is true that if the testosterone is very low, you can have impact on sexual functioning, and sometimes supplementing with testosterone is the solution. What's called there is testosterone replacement therapy. Now, this isn't the solution for most cases, though, and you should know that. And even when it is a possible avenue, the injectable type of testosterone is something like 10 times cheaper than the topical ones. So you'd have to be prepared within your lifestyle to be injecting yourself with testosterone. So since that's not the solution for most people, what can you do? Well, if you're overweight, if your body mass index is 30 or over, you're obese by definition, then you should address that. You should try to lose the weight. If you lose the weight, you may see some improvement already with that. The other thing is lean muscle mass. So as you lose weight, is to exercise and gain some muscle mass. As you lean out your body will naturally increase more of its levels of testosterone naturally as a proportion just by your body habitus. If you have obstructive sleep apnea, which again is something that's associated with people that are heavier or in the obese category, obstructive sleep apnea can reduce your testosterone levels as well. In terms of nutrition, well, if you're getting more plant protein can help as opposed to animal protein. So if you start to increase your intakes of vegetables, in particular legumes, also that have protein and have plant fiber and plant nutrients, that can help you. In terms of supplements, well, it's important that you have adequate levels of vitamin D, and there are over-the-counter supplements of vitamin D that can be used. And you're getting enough zinc. And zinc, again, is something that's available on the plant side from some of your beans and legumes and things like that. Otherwise, a small supplementation of zinc is adequate. Now, I know nowadays they're selling these zinc supplements that are 50 milligrams and the like. You don't really need that much. And by the way, some of these people that are taking zinc notice that they get a little nausea with it. So the lower doses, the better. 10, 11 milligrams, something like that is usually what you'll find recommended. What else is there? There's stress. Stress can impact some of the symptoms that you might think are due to testosterone, like that sensation of feeling tired, of not sleeping well at night, those things. So whatever you can do to address the stress issues in your life and reduce stress, and I have some videos on stress, that can help deal with symptoms that you may think are due to testosterone but aren't. And again, I'll highlight this, that many men that start supplementing and go on testosterone replacement therapy, they don't notice any real improvement. Why? Because all these other components in their lifestyle is not being enhanced. What other thing? Excessive alcohol consumption. If you're drinking more than 21 drinks a week, for instance, that's about 3 drinks a day or more, that's a lot. That can decrease your testosterone as well. If you're taking other substances, maybe they like pot or marijuana or those things, you should stop that as well. That can impact your performance and your mood as well. So exercise, maybe lean more towards trying to get lean. So do some aerobic exercise, but don't forget some resistance exercise, a little weight training, things like this, so you can build some muscle mass. That can improve your testosterone. You have your nutritional components, try to shift more towards the plant protein base. You have your stress components of reducing stress if you can, and you have sleep at night. If you have obstructive sleep apnea, make sure you're taking care of that. A lot of these issues, if you're losing weight, can improve your issues with apnea, can improve issues with testosterone, etc. So these all work together, and many times you'll find you make these changes, and over the next few months you'll find either an improvement in the testosterone level or an improvement in the symptoms that you think might be due to testosterone being low, which aren't necessarily the case. So again, if you like these kinds of videos on advice on how lifestyle can improve your health and well-being, click subscribe so you don't miss out. Click the little bell so you get notified, and click the thumbs up. And again, until next time, I'm Dr. Nunez with Living Health.